in 9 people age 65 and up has the disease. That's 11%. By 2060, the number of people age 65 and older with Alzheimer's is projected to be about 13.8 million, so almost doubled. Next slide. And so here's some facts and figures. These are from the Alzheimer's Association. So 1 in 3 older adults dies with Alzheimer's disease or another dementia. Alzheimer's kills more than people with breast cancer and prostate cancer combined. And then between 2000 and 2024, deaths from heart disease decreased by 3.8%, while deaths from Alzheimer's disease have increased by 134%. Next slide. So some of the common early symptoms of Alzheimer's disease include trouble remembering pieces of recent events, trouble completing daily tasks, and maybe kind of getting a little bit lost or turned around when you're driving a familiar route. And to emphasize that these changes are not normal part of aging. And these symptoms are not the same as normal forgetfulness, which can happen to any of us as we get older. Another thing I will say that we've learned in the research is that a lot of people get very concerned about their inability to think of names as quickly as they used to be able to. So thinking of someone's name that you maybe ran into the grocery store, or thinking about the name of a movie or an actress or a restaurant, it takes longer to think of that. And some people think, oh, is this the first sign of me getting Alzheimer's disease? But what our research has shown that actually that's not true. An actual normal part of aging is a slower processing time. So you kind of think about, in your brain you have file cabinets of information. So you think about walking through a hallway to get past many different files. So it takes longer to get through that hallway, but you do eventually find the file, you find the name of the friend, and you're able to remember it. So it's more of a slower cognitive processing versus developing dementia. But a lot of people get concerned about that. The next slide. And the symptoms of mild Alzheimer's disease, well, basically I want to clarify that mild here means that they're somewhat progressed through the disease. So these are not going to be your first symptoms that you see. So mild is kind of progressed a little bit more from there. So poor judgment leading to bad decisions, losing track of dates, repeating questions or forgetting recently learned information, trouble handling money and paying bills, taking longer than normal to complete everyday tasks, and mood and personality changes. And Alzheimer's disease is really kind of different for everyone, but these are kind of the general pattern that you can see. And then next slide, these are the symptoms of moderate Alzheimer's disease. So when the disease is worsening even more. So difficulty recognizing family members and friends, needing help with daily activities like getting dressed, fear, suspicion of other people, or belief in seeing and hearing things that aren't real, so auditory and visual hallucinations. Next slide. And then the symptoms when the disease comes very severe. At this point, some people might need full care. They might be living in a nursing home or having 24/7 support services at home. But loss of ability to communicate is common, and then just the need for that full-time care because of safety issues. Next slide. So what are the causes and risk factors for the disease? So the first, the greatest risk factor is actually age. So this is one of the only diseases where just by being alive and having a birthday increases your risk for the disease. So the older you get, the higher your risk for Alzheimer's. Family history can increase your risk. Does not necessarily mean that if your parent had it, that you will get it, nor does it mean that you have a 50-50 chance of getting it. It just means that you have an increased risk. Genetics can play a role in your risk. There's two specific types of genes, these alleles that we have. Everybody has two copies, and there's a number 2, a number 3, and a number 4 version. And so everybody kind of gets two of those numbers. The 2s can kind of decrease your risk. The 3s are kind of neutral. But the 4s, if you have those, that increases your risk. And if you have 2 of the 4s, then you have a higher risk. There's also 3 very rare genes that actually cause Alzheimer's disease. So again, these are very rare, and people who have these genetic mutations, they develop Alzheimer's disease very young, so in their 30s, 40s, and 50s. And generally, when you have early onset Alzheimer's, you pass away from it a lot more quickly than someone who has just kind of the older age Alzheimer's. So also, since we don't really know what causes Alzheimer's, there's modifiable risk factors that are named, and we'll go into that in a minute, as things that could increase your risk, and also certain medical conditions. So again, we really only know about risk factors, not the causes. So next slide. What conditions might increase your risk? So things like smoking, having diabetes, high blood pressure, an unhealthy diet. Basically, they say what's good for your body is good for your brain. All right. And then how can the disease be prevented? So there's steps you can take to reduce your risk. So doing things that are healthy. So not smoking, keeping your body and your mind active, staying in touch with family and friends, eating a healthy diet. Another 2 that I wanted to add that aren't on there that have been revealed from more recent research is that sleep is actually really essential to reduce your risk, because whenever you're sleeping, basically one of our doctors says your brain takes out the trash while you're sleeping. So everybody has a normal amount of amyloid in their brain, but whenever they develop Alzheimer's, you get a greater amount of that amyloid in the brain. But while you sleep, your brain basically removes that amyloid. So if you're not getting good quality sleep, and the average recommendation is 8 hours per night, if you're not getting good sleep, you're not taking out the trash in your brain, theoretically. And so that increases your risk. The other thing is having hearing loss. And not so much just having the loss itself, but if you have hearing loss and you are not using prescribed hearing aids, that can increase your risk of dementia, because it's important for you to receive auditory brain inputs to keep your brain healthy. And that's probably one of the newest areas of research, is the association with hearing. Okay, next slide. So more things you can do. Maintain your healthy weight, drink alcohol in moderation, drink coffee in moderation. Again, what's good for the body is good for the brain. And then I just wanted to list a few myths here about Alzheimer's disease. First one is that memory loss is a natural part of aging, and that is very much untrue. It is not normal to have any kind of progressive memory loss. And if you find that somebody in your life seems to have any of these symptoms, it's good to recognize it as a problem and talk to your physician about it. The second one, Alzheimer's disease and dementia are the same thing, and we clarified that earlier, that Alzheimer's is a type of dementia. And number 3, it is not possible to diagnose Alzheimer's until autopsy. That used to be the standard, that they would say that you don't definitively know if somebody has Alzheimer's disease until you look at their brain. I mean, that is the gold standard for diagnosis. However, there are many ways that physicians can test for Alzheimer's disease. there's imaging of the brain, so PET scans where you get an IV injection of a tracer that can basically kind of light up the areas of amyloid and tau in your brain. And certain levels of the pathology can indicate whether or not you have Alzheimer's. You can also test for Alzheimer's by getting a lumbar puncture or a spinal tap. And certain proteins in there can kind of speak to whether or not you might have Alzheimer's. And also a newer development are blood tests. And they're hoping to use the blood test to replace the more invasive and expensive testing to diagnose Alzheimer's. So the blood tests were actually developed at Washington University, and they have about 97% accuracy, or basically it's 97% as accurate as it would be to do a PET scan or a lumbar puncture. And it's much less invasive and much less expensive. The last myth is that there are no treatments for Alzheimer's disease. So this has changed only just in the last few years. So historically, there are some drugs that physicians prescribe just to kind of manage symptoms. So basically, they help your brain function a little bit better. They work with the neurotransmitters in your brain, and they keep a neurotransmitter called acetylcholine kind of more active and more present in your neurons, and without your brain kind of reuptaking it too quickly. So it kind of just helps your brain function optimally. So those types of drugs are the historical ones that have been diagnosed since, I believe, the 90s. But more recently, there's been 2 medications approved by the FDA that are administered by intravenously, by IV administration, where it actually addresses the actual pathology in the brain. So these 2 drugs, they are anti-amyloid antibodies. So amyloid, the one kind of major player in the disease, they're able to remove the amyloid from the brain. It does come with side effects though, serious side effects. The side effects are brain swelling and brain bleeding. So people who get these medications are routinely monitored by MRIs just to make sure that they're not having any of those problems. And they're also very expensive. So, but insurance has finally provided coverage for them. And one thing about them also is that they're not a cure, and they only help to reduce the decline that you find naturally in Alzheimer's disease. So basically, over the studies, they showed a 30% decrease in decline over an 18-month period. So that's the longest that they tested these drugs out for. It was just 18 months. So basically, you can have kind of a temporary decrease in your cognitive decline, but it's not, it's really not the answer for the best treatment. So research is ongoing. There's clinical trials ongoing for a better drug that can address the condition better and also not have such serious side effects. Next slide. So the next steps, if you're concerned about yourself or a loved one, you definitely want to speak to your physician. Again, these are not, the changes in cognition are not normal parts of aging, so you want to address it with your doctor, especially now that there are treatments available. They're not ideal, but they are available where they hadn't been for many years. And so you can talk to your primary care doctor, but ultimately, the best care that you're going to get, the best assessment that you'll receive is going to be from a memory care neurologist. And so, not just a general neurologist, it's very different. Somebody who works and specializes in memory care, because they're very familiar with the different types of dementia and the types of testing that they can do. And also, it's important to just reach out for education. So, the Alzheimer's Association, which they provided me with some resources back here if you're curious, you can reach out to them. They have a 24/7 helpline. And the numbers up here, they provide education, local resources, assistance with if you have a crisis related to the disease and just maybe as a caregiver, and also emotional support, and that definitely relates to caregivers because it's a large and hefty responsibility to be the caregiver for somebody with dementia. So certainly don't hesitate to reach out to educate yourself, and because the more that you know, the more that you can increase the quality of life of somebody with dementia and also yourself as a caregiver. All right. Thank you so much. Appreciate everyone's attention.